Exercises are an important part as you prepare for your surgery and during your recovery. You should start these exercises prior to surgery to focus on strengthening specific muscle groups needed. Some patients may also be working with a physical therapist prior to your procedure. Your therapist may adjust your exercises based on your needs. The number of reps and sets to do will vary by patient. Prior to surgery, start an exercise and see how many reps you can tolerate. This can be anywhere between 5 to 30 repetitions and 1 to 2 times a day. With some exercises, you may be able to do more reps than others. Some exercises may be too painful. General muscle pain and soreness is expected, especially if your mobility has been low recently. The goal of the exercises is to improve your strength and maintain range of motion you have. By being too aggressive with the range of motion exercises, you may cause significant pain and swelling in your joint, and this should be avoided. These should be done in your bed or couch, not on the floor. For both a total knee and a total hip replacement, you will do these next 4 exercises. Armchair push-ups. While sitting in a chair, place both hands on the armrests of your chair. Lift your buttocks up off the chair, then slowly lower it back down. Armchair push-ups are important to strengthen your arms prior to surgery. This will assist you in using a walker. Ankle pumps are the most important exercise to do following surgery to prevent blood clots. A good rule of thumb is do a few ankle pumps every time a commercial comes on the TV, or every 15 minutes during the waking hours of the day. You cannot do too many ankle pumps. Quad sets. Tighten the muscles on the top of your thigh by pushing the back of your knee into the bed. Hold for 5 seconds, then relax. If 5 seconds is too long to hold, start with 2 to 3 seconds and progress to 5 seconds. This exercise improves the stability of your hips and knees and can improve your walking. It will also prepare the muscles you need to stand up and sit down from a chair independently. Straight leg raise. Lying on your back, bend your unaffected leg and place your foot flat on the bed. This will take pressure off of your back while doing the exercise. Keep your affected leg straight and lift 6 to 12 inches off the bed. Slowly lower it down. Lowering the leg down slowly is just as important for strengthening as lifting your leg. If you are unable to lift your leg on your own, use a sheet or a belt around your foot to assist. Use your muscles as much as possible and use the belt or the sheet, only assisting as needed. For a total hip replacement, this exercise should not be done following surgery, unless directed otherwise by your surgeon. These exercises should be done before and following a total hip replacement. Gluteal sets, also known as a buttock squeeze. Tighten the muscles in your buttocks. Hold for 5 seconds as tolerated. This exercise can be performed laying down in bed or seated in a chair. This is another exercise that will help you maintain your ability to stand up from a chair and to maintain stability when you walk. Hamstring sets. While lying on your back in bed, dig your heel into the bed towards your thigh and tighten the muscles in the back of your thigh. Hold up to 5 seconds as tolerated. You can bend the opposite leg up for comfort. This exercise can also be completed in a recliner. Hip abduction slide. While lying on your back in bed, slide your affected leg out to the side until you feel a gentle stretch, then slide your leg back. Make sure to keep your knee and toes pointed up at the ceiling. Doing this exercise in your bed without a shoe will help decrease the friction of the bed. If this exercise is unable to be done on your own, a sheet or a belt can help assist your leg. Again, only using the sheet or the belt as necessary and contracting your muscles as much as possible. Hip flexion. While lying on your back in bed, lift your surgical leg up and bend your knee towards your chest. You will feel a gentle stretch. Make sure to keep your leg from rolling inward or outward while doing this exercise. Controlled movements when lowering are just as important as lifting your leg. You can place a towel, a sheet, or a strap around the bottom of your foot or behind the thigh to help you move your leg. Don't ever force this motion beyond what is tolerable. Standing hip abduction. While standing in front of a sink or a counter for support, Lift your affected leg sideways until you feel a stretch. Make sure to keep your toes forward so you are using the appropriate muscles. Controlled movements on the down phase is just as important as lifting your leg. Try to avoid side bending your trunk when doing this exercise and focus on just moving the leg at the hip. These exercises should be done following a total knee replacement. Short arc quads. Place a towel roll under your affected knee. Lift your lower leg to straighten your knee. Once this gets easier, you can add a 5-second hold at the top before slowly lowering your leg down. Controlled movements on the down phase are just as important as lifting your leg. The back of your knee should always stay connected to the towel throughout the repetition. Leg prop. While lying on your back, place a towel under your ankle and allow your leg to hang. For some patients, this may provide a strong stretch. Other patients may need to add an ice pack to feel a stretch. This is a passive motion, meaning no muscle contraction. Allow your leg to relax in this position as tolerated, but no more than 10 minutes at a time, unless otherwise directed. Note that the ice pack should not be directly on your skin. There should be a barrier, a towel or a washcloth or a pillowcase between the ice pack and your skin. This exercise can also be done seated in a chair. Use another chair, bench, or stool to place the ankle of your affected leg on. Try to alternate positions from one session to the next when doing these exercises. The goal is to get your knee fully straight or to 0 degrees, which allows you to have a normal gait pattern. Heel slide. Lying on your back, bend your affected hip and knee towards your buttocks. Use a sheet or belt to assist in increasing your range of motion. Hold for 5 seconds if tolerated at the top. Keep your knee and toes pointed towards the ceiling while performing this exercise. It can be helpful to use a plastic bag or a cookie sheet underneath your heel to decrease the friction of the bed. Long arc quadriceps. This exercise is similar to the short arc quads in lying. When performing, both exercises do not need to be performed in the same session. Try to alternate the position and exercise from one session to the next. Perform this in a supported chair. Lift your lower leg to straighten your knee. Once this exercise gets easier, you can add a 5-second hold at the top before slowly lowering your leg down. Controlled movements on the down phase are just as important as the lifting of your leg. The back of your knee should stay connected to the chair throughout the repetition. Seated flexion. It is ideal to sit in a chair that allows you to slide your heel under the chair that you are sitting on. Having a smooth surface under you and a sock on or a washcloth under your foot will allow your foot to slide easier. Sitting forward in the chair, slide your affected foot backwards as much as possible or until a stretch is felt. Hold the position for 5 seconds and slowly slide the leg forward. This stretch can be held longer as pain will allow. The typical goal post-surgery is to get the knee bending to at least 120 degrees, which will allow you to go up and down the stairs in a safe manner.